Hey, Jim, if you're on there, it says people are paused. Got kicked off. But again, good afternoon to everyone, and thank you for attending our
live?
Our Code 6.4 webinar today. My name is Christy Saul, and I am one of the two VPs of marketing for URL Insurance Group's Health Options Division. And I'm not going to get into a lengthy introduction of URL, as most, if not all of you, are familiar with us and have used our services before. And for those of you who just got through the insanity and the ever-changing dynamics of open enrollment, I commend you. And I hope you are still standing and haven't pulled out every last piece of hair in your head. I know it was rough here, and I know it was rough on everybody out there, and I've talked to a few of you, and you're glad it's over. As we all know, the insurance market is changing every day, and I don't need to tell you all the premiums are rising and commissions are decreasing. And I've been talking to our agent partners for the past few years about the need to diversify or die, so to speak, on the individual side as well as the group side. I see the group renewals rates coming in, and they're not pretty. And there are a few ways you can go about talking to your clients, the employers, and their needs. The first way is you could just stick your head in the sand and be an ostrich and not face the issues head on. You could become a cost shifter, have your client stay with the same carrier and raise the deductibles or pass more responsibility on to the employees, or just not offer insurance at all. Or the best option, I think, is to be like a Thomas Edison and think outside the box. What's really best for your clients? Is it HSAs? Is it defined contribution, HRAs, self-funding, or going to individual plans? Worksite products. There are lots of options. So there are a handful of group carriers out there, and quite frankly, the rates are the rates. You're going to come back with a renewal rate or get a new group rate, and there's only a handful of carriers out there, and again, the rates are the rates. So if you're in competition for a group with another agent, again, the carriers are the carriers. But if you come to that employer with other options and something different, odds are you're going to earn and trust and get their business. Code 6.4 allows you these options. I'm really, really excited about it. On the call today with me is Eric Wrench from Code 6.4, who's going to be doing the presentation. And a little background on Eric. He is a co-founder and COO of Code 6.4. His background is in consulting and independent distribution sales, organizational design, and HR strategy. As a former practicing consultant at Mercer Consulting, Eric has worked with a broad range of clients, from large insurance carriers to insurance agents and brokers. And he is really a recognized expert in the insurance and healthcare industries. So that is my intro. I don't want to waste any more time looking at our website. So I'm going to hand it over to Eric to begin the presentation. And you're welcome. And just to let everybody know, we will take questions at the very end. There's a little box in the bottom right-hand corner you can type your question into, and then I'll read them out, and then Eric, being the expert, can answer them. So, Eric, take it away.
Fantastic. Thank you so much. Can everybody see, or Christy, can you see my PowerPoint?
I cannot. I think there's a little box you have to click to accept to be the presenter. It should have popped up.
See if I'm making this work. How about now?
No. We are having issues today, aren't we?
Should be something on the control panel, Eric, that shows you that lets you show your screen. There
we go. Now we got it.
Now. We got it?
Yes.
Okay. Super. Sorry about that, everybody. And thanks, Christy, for that introduction. Very excited to be speaking to you all today. I thought it would be helpful at the beginning of this conversation. I want to spend most of the time today really focused on the specifics of what Code 6.4 resources can do around some of that, Thomas Edison style innovation that Christy was just talking about. But I thought it'd be helpful at the beginning to just, provide a little bit of context and, introduction about, who Code 6.4 is and really what we do to frame out some of that more specific client strategy information. So our mission at Code 6.4 is really grounded in the fact that we believe that benefits advisors and brokers are in the #1 position to influence the way employers are thinking about their health and welfare strategies over the next several years. So despite the fact that you'll hear, and experience a lot of difficulty as this transformation is bearing down on the industry, we have a firm belief that you're in the best position to help employers navigate it and that they desperately need your expertise and your advice. What we're finding in conversations that we have with agents and brokers really across the country is that they're seeking new strategies to help clients implement real practical solutions, largely in response to healthcare reform, but also in response to what are private industry trends that are just emerging to help clients, employers deal with rising costs and new ways to attract talent and build really, really solid HR strategies. And what we found is that best practices and strategies, they do exist, but not everybody's using them, and not everybody's putting them into practice successfully. Quite frankly, they're not easy in a lot of cases, but that doesn't make them not good. That just means they need a little more effort and control to really put them into practice successfully. So our mission then is to unlock the potential of health and benefits professionals by equipping you all with easy-to-execute world-class insights and tools. And really, this is a reflection of what we see as an enormous opportunity in the industry. I take a very positive spin on what we're all dealing with right now. The fact of the matter is that with group clients and business owners of all sizes, you've got more attention on health and benefits than really ever before. They're paying more attention to it off-cycle, so to speak, outside of the renewal period. You've also got new products and services that are enabling more innovative plan designs available in the market. You've got new technologies that are making it easier for consumers, the users, the employees, to actually see the value in their insurance and to really become empowered to make decisions about their own health care. Employees care more as a result, so the opportunity to capture loyalty there is high. And what all that boils down to is that clients and customers, they need more consultative support now more than ever. Those are all very typical trends that happen in any transformation that goes on in any industry. And these are things that have always spelled the need for counselors and advisors to provide support for the decision makers, the business owners and the HR leaders. So what Code 6.4 is, just a very quick sense, we do market research and we build reports and analytics that are then automated for our users so that you can position and sell new services. You can stand out with professional materials, national ABC House type of consulting materials. And so you can take action and give proven, convincing advice to a client with confidence that you know is right. That we're focused on, what we do on a day-to-day basis is talk to brokers, across the country, learn what works, learn what doesn't work, and we boil all that into the content that we make available to members. So, the practical application, there should be some stuff, there we go. The practical application of the way this works using Code 6.4 is, we have our online member center, which is like your strategic back office. You access Code 6.4, you can download materials, and then you have prepackaged, ready-to-use client information that you can bring into the next executive meeting or thought leadership that you can present at local SHRM events or, NAHU speaking opportunities or any industry association that you may be a part of in your local community. So here's just kind of a snapshot of just a few sample resources. There's literally dozens of tools and templates and things all focused around the concepts of benefit strategy and benefits design. But I wanted to just pick a couple. We have tools and templates that frame out a voluntary benefit strategy, how supplemental insurance can be paired with major medical coverage in an effective way for clients in order to provide them a robust benefits package at a more effective price. Strategic benefits planning is all about the process of actually putting rigor to the way a client makes decisions about their benefits throughout the year, not just reacting to, a renewal quote that a carrier gives them and then trying to decide sort of in the 2-week period before re-enrollment how they're going to handle that. That's not the approach. That's not strategic. Strategic is about getting ahead of that by predicting risk, identifying opportunities, and working with clients to be able to manage all that in advance of renewal. Small business benefit strategies is really kind of our, I don't know, what would I say, nuts and bolts almost, like the core offering that really gets to the what can I do in my benefits plan design to alter the way the employer is structuring their small group benefits in a more cost-effective way. And then the large employer healthcare reform analyzer, this is, a diagnostic tool that really works in the 50 and up market that is for, building pay-or-play response strategies for large businesses and helping them plan for the employer mandate. So I wanted to focus today on this one in the upper right-hand corner, the Small Business Strategies 2014 and beyond. So I'm going to take you guys through, a lot of the content and describe how it works in terms of, what type of influence and advice you'll be able to provide your clients using this content. But before I do that, it's quite important that we talk about a study that Code 6.4 did last year in June and July. We surveyed about 500 employers, and then we did a follow-on survey to about 1,300 independent agents and brokers. And what we found through so we looked at that through two angles. We looked at, the perspective on the industry from the agent and broker's perspective, and we looked at the perspective on the industry through the eyes of the HR leaders and business owners. I want to talk briefly about what the HR leaders and business owners said in that survey, and it's really, captured in this study that we have called 4 Types of Benefits Buyer Cultures. Very simply, what we did was we collected data, and then we, analyzed that data very rigorously to try and identify sort of consistent responses that employers have to healthcare reform. Why is that important? It's important because at the end of the day, there are only so many ways you can handle the burden of the ACA, and employers are, in some cases, more willing to take on that burden than others. And so there's quite consistent responses. You guys may have experienced this through conversations with clients. You'll have some clients that are vehemently opposed to anything and any cost that gets added. And that's kind of the, that's the excitable stories that you'll hear any agent talk about, which is that my clients hate this, it's a burden, it's difficult, it's all these things, which is true, it is. But there's also clients who, they're not in love with the ACA, but they're more prepared to handle it, and they're more willing to kind of accept the added cost and, deal with it because they're committed to the concept of group benefits for their employees. So what we did in this study was, we looked at this through the agent's perspective and the HR perspective, and we found that there are 4 types of employers, and they're responding to healthcare reform in very consistent ways. And we did this based on their response data. I'm going to jump back to this slide in a second, but what the essence of what varies in their response is some of what I was just talking about. Is their tolerance for risk? Okay, are they open to change? Are they open to some of those Thomas Edison-style ideas that Christy was talking about, or are they a little scared of those because they want to sustain their current state? Are they in a position where they believe they can actually take a proactive approach in response to the cost of health insurance, or do they think that this is just something that happens to them that they just have to accept? Do they look at benefits through more of a legal perspective, or do they look at it more as a strategic asset that they can offer to employees, and that's something that adds value to the business? Are they more likely to anticipate change, or are they more likely to react to change? When they communicate to employees about benefits, are they more upfront? Are they more honest? Are they more sort of congenial and casual, or are they very reserved and not so upfront about the information? And then, all that kind of connects to the way they manage their benefits. It's, is it an afterthought for them where they kind of, react and, oh my gosh, what are we going to do about this? Or is there sort of a strategic plan and, a more methodical approach to it? So these are the types of questions we ask them, okay? So I say all this to kind of give you a sense of what the survey was really trying to get at. And through those responses, we identified these 4 types of benefits buyers, okay? And sometimes you're going to find that these are fairly concentrated in a particular industry or, they're concentrated in a particular market. But across the country, nationally, you're going to see this distribution where kind of the middle two, the status quo and the by the book, are the more prominent styles of employer responses to healthcare reform, and the sort of less prominent styles are the indifferent and the aggressive adopter. In a nutshell, the indifferent, if I just walk through the 4 of these very quickly, because it's going to relate to how I talk about the content and the tools, in a moment. The indifferent style is, the employer who doesn't really believe benefits are a competitive differentiator. They may have a very, sliver of a belief that there's a moral obligation for them to provide benefits to their employees, but they don't really think it does much in terms of impacting business outcomes. They have a limited understanding of healthcare reform, and what they do understand is more likely to be politically charged. Generally found at smaller companies, but that's not exclusive. They can be at larger companies. And it's pretty typical that you'll see they have sort of bare bones benefit plans. The status quo, these are the employers who, they genuinely believe in their current benefit structure, but they're keen to look for ROI on any type of change. So they want to see a bottom line impact. They really don't have a strategy for the way they manage benefits, and they kind of more reactive to the way cost and change happens in the industry. And they're generally found more at mid-sized firms, but again, not exclusively. They're all over the board. By the book is a little bit more on top of things, okay? They kind of are interested in looking at benefits through a legal perspective. Kind of makes sense, by the book. The more legalists and strategists, they believe benefits add value, but it's more of a cost of doing business than it is an asset to the company. They're more reserved in their communication. They're going to be, not the type to adopt, cutting-edge videos that are broadcast to every employee to talk about the fun aspects of, all their benefits programs. It's more of, a print booklet that they send out every year, and, they want to make sure everything is ticked and tied. The aggressive adopters are the ones who really believe in the value of their benefits package. They're 2 times more likely than other profiles to have a total reward strategy in place to really look at benefits in the context of their overall business. They generally are more open to sophisticated strategies. They're more open to looking at really innovative programs that may save them money but also add value. Generally found at larger companies, but not exclusively. They can be anywhere. A lot of this, naturally, you'd expect is a reflection of who's there. What people are we talking about? You could have a person who's a business owner that has one of these profiles, and they really drive the culture of the business. But if you had a larger company, 30, 40, 50, 60 employees or more, you might have 2 or 3 people involved, and so they kind of, each of them combined really makes up what might be their culture. The point of, so what? It's very, very interesting. So, seems kind of, nice that there's these 4 profiles. What do I go do about it? Well, the interesting thing is that the indifferent are more likely to be open and interested in the idea of dropping their benefits plan. The status quo are more likely to be open and interested in maintaining their existing group plan, but trying to find ways to, make some small adjustments, to what they have to offset the cost. By the book is more open to defining contribution as a strategy because it maintains the benefits program, but it fixes the cost. They're the ones who don't really see the ROI on benefits. They think of it more like a cost of doing business. So they want to maintain it, but they want a very cost-effective way to do it. So they're more interested in defining contribution. And then aggressive adopters are, they'll do a lot of different strategies, but they're the ones that are going to be more interested in those innovative style plan designs like partial self-funding, a high-deductible health plan with an HRA, or consumer-driven health plans, a high-deductible health plan with an HSA, or pure self-funding, a product, that the company is self-funding their benefits program altogether. They're also much more likely to adopt an aggressive wellness program. So again, these percentages up here, are fact-based and validated, but like I said, in local markets, they do vary a little bit. You might have, this is the national percentages. So, in a given market, you may say, I'm dealing with a lot of indifference. That's who I'm talking to. Or I'm talking to a lot of by the books. They're sick and tired of the cost and they need a solution. the point of what I'm getting at is that knowing who you're talking to is important because they told us what they wanted in the survey, and the profile that they are is a very strong prediction of what they're going to do over the next 2 to 3 years, quite honestly, with or without the agent they're currently working with. They are looking for a program, and they're going to find someone who can provide it. And so, having a means to identify these types of profiles is a really effective strategy that a lot of our members are adopting. So let's get into some of the content. I want to show you guys some of the actual material that Code 64 provides. The small employer benefit strategies is the one I'm going to focus on today just because we won't have enough time to cover everything. But, I want to give you guys a sense for the depth of content and really what it talks about and what it focuses on. So the preliminary materials here, it's the kind of stuff that you could use to, give to a client and, present to a client to tee up the conversation around, any type of change you might consider recommending on a benefits program. Just a quick sidebar, I have some agents and members that sort of don't love presentations, in PowerPoints. It's not their style. They're more of a conversationalist. We're of the opinion that these are very heady concepts and difficult topics, okay, and they're not easy to break down in simple terms. So we do invest a lot of time in making sure the slides make it as easy as possible to understand what is a very difficult transformation going on in the industry. That's why a lot of our stuff is grounded in actual PowerPoints and professional material, because those types of leave behinds are very valuable for clients who aren't able to necessarily sort of sit down for 30 minutes or an hour and remember everything that was discussed, because there's a lot going on. So this is, like as I was saying, sort of a proposal, is the introductory material that you could use to explain the essence of what you're going to try and work through with a client. Sorry. So, this page is all about saying that there's a lot of new things going on in the industry. That's kind of the bottom line. We're in the midst of a fast-changing landscape. We've got new regulations. I'm talking community underwriting, metal levels, pay-to-play, small business tax credits, deductible caps, everything. It's all just incredibly complicated and new. You got new exchanges, both private and public. You got new vendors providing wellness strategies, resources, and benefits tools. You've got new carrier products. You've got consumers with a whole wealth of questions. And you've got, in some states, new co-ops and new insurance carriers altogether. The point of all that is to say that, imagine you're sitting down with a client, is to say the reason for our meeting today is I want to talk to you about the implications of all that change specific to your organization. The implications are that there are new strategies available for the way you might choose to offer benefits. Now, quick sidebar. I have some agents, okay, I've stepped out of the meeting and I'm talking to everybody on the call today. I have some agents who get a little leery about presenting sort of all the options on the table because you don't quite know where the client's going to take you, and it can be uncomfortable. And my position on that is that you want to get ahead of the changes that are going on in the industry. If you don't present this, someone else will. And you're in the best position as a trusted advisor if you're talking to your clients about this material proactively rather than reactively. So that's why we believe the best practice is lay it all out on the table and talk to them about what's good or not good about each of these approaches, which is what the content helps with. So new strategies are available. I'm stepping back into the client meeting, and I'm talking to the client. New strategies are available, and I want to talk to you about what the implications of those are on your business today. There are a diversity of approaches here, and there are pros and cons to each of them. It really depends on the demographics of your group, the number of employees you have. Are they married or single? Are they older or younger? Where do they live? What is their household income? It's the specifics of your employees that will drive what the most effective approach is for your business. Now, in the back of your mind, you need to also be thinking about what the culture of your client is. What do they really want to do? Are they a by the book? Are they more likely to go that private exchange defined contribution route? Are they more status quo, a little hesitant, want to keep the group health plan? So you got to be thinking about that. But there's also just the essence of what do the hard numbers tell us? Are employees subsidy eligible? What's the renewal that we received? It's very possible that you could have a group with older demographic, older employees. And the age-banded community rating methodology that the government has just rolled out will actually lower premiums. That is possible. It's not common. I just want to stress that I haven't seen that happen a lot, but it is possible, especially if you have, a smaller group that's also eligible for small business tax credit. That can be something that makes for a very advantageous situation to maintain group health benefits. So there are pros and cons, without walking through kind of each of these in detail. The essence of, the public exchange approach is, are your employees likely to be eligible for subsidies, which our tool is going to identify? Are you on a defined contribution? Are your employees, interested in kind of more choice and more opportunity, more ability to select whatever benefits they're most interested in personally? For the group plan, is this a better means to manage risk at your clients and based on the types of employees that they have than, say, self-funding in some states? And I believe this is going to be a trend that's rising over the next several years in all states. Many carriers are changing the networks so that their individual products have not as attractive networks as the group products. And then you've also got potential for small business tax credit. So let's kind of walk through some of the details of what's underneath each of these. And they should be in order, but they're not. Strategy number one is maintain group benefits, okay, which is this third one right here. Sorry about that. One of the things that we do in the analytics is we have collected the small group rates, actually across the country, but we'll talk about Pennsylvania. And what we do is we take everything that it would take to get a quote, except for we don't do it by carrier. So we look at it by age, we look at it by where they live, what rating area they're in, and their household makeup. Do they have kids, or are they married? And we use that to build sort of a hypothetical quote for a comparable product to what they're currently offering. And you can then show your client that this is effectively the trend going into renewal. So like I have some clients that are running this for 5/1s right now. And what it shows is this is kind of what we're dealing with going into renewal. It's all about positioning in a lot of ways, okay? You may be looking at a 20, 15, 25% renewal. And a client who sees that is going to have sticker shock, or 50% renewal. I've seen worse. Is going to have sticker shock at these numbers. And so showing them the market trend is going to help you when you go back to them with maybe a $10,000, $20,000 renewal that's only 5 to 10%, be able to explain why that's actually a really good thing. And again, if they're committed to continuing to offer group benefits, that's the best that they're going to get. And you can ground it in this data right here, which is the market trend. In this case, is $86,000 for this particular group. Obviously, those numbers change depending on what data I load. The other thing that the tool will identify is there are whole new slew of taxes that the government has added to your group benefits policies, and we calculate what those are specific to the group. So this is another way to explain to a client, all right, part of that renewal increase is coming from these taxes that the government has levied. Now, these are paid by the insurance carrier, for all fully insured plans. So this isn't a separate bill they're going to get, but just like anything, government adds a tax to airline tickets, you're paying for it, not the airline. Government adds a tax to insurance, employer and employee is paying for it, not the insurance company. The insurance company is just line iteming it and adding it into the cost. So you can show them what that cost is specific to their group, and the math, it's calculated. The other thing that the tool will do is forecast exposure to the excise tax in 2018. Not a lot of people are talking about this right now, and we're encouraging all of our members to spend a lot of time talking about it. And the reason is because this is monumentally detrimental. It's a huge problem, big problem for anybody who's got a group benefits plan. As soon as this kicks in, your cost to offer that particular policy is going to be enormous. Specifically, it is 40% of whatever dollar is above the stated threshold that the government has. What we do here is, based on the plan that they currently have, we'll estimate their exposure. So this is yellow in this case, which is moderate exposure. You have some exposure to it. That's kind of like, you got a problem. If it's red, it's a real big problem. If it's green, you're okay. So that's a very valuable insight to offer your client. Imagine it's a prospecting tool, going into another account, showing them that exposure can highlight for them how you can help them avoid it by sourcing a different product or a different plan. we take all that cost and we benchmark it on a national scale, and we show the client, where do you fall in terms of ACA impact? Are you above average or are you below average? And then the question becomes, what do we do about it? So this is where we get into some of the, innovative plan design types of strategies. And we're big believers in consumer-driven health plans and supporting, major medical plans with the right supplemental coverage. Not overkill supplemental coverage, not over-insuring, but the right supplemental coverage that employees are going to want to buy. So what the reports can generate is a recommendation about how to offset cost on the plan, cost shifting, if that's what the employer says, that, I really don't want to change our plan this year. We've been making a lot of other changes. That's what I want to do. If that's what they want to do, we'll lay out that recommendation. If they're open to moving to a high deductible health plan or altering their coverage and adding supplemental products, we'll look at the demographics, or I should say the analytics engine will look at the demographics, and it'll recommend the right coverage. So of available products, hospital indemnity, critical illness, accident, life, disability, vision, and group legal is one of the offered ones. Then we will say, the ideal buyers of hospital indemnity coverage are individuals under 50 that make less than $40,000 per year, and your employees fit that profile to a T. And we actually think we could get enrollment around 59% if we do, a very effective enrollment event. So this is about framing for the client in a consultative manner the advantage of the right supplemental coverage and how you can help them implement that strategy. I know I went through that fairly quickly, but I want to make sure we get to all four of these. So strategy number 2 is the details around what if we were to drop our plan. Again, I have some clients that choose not to present this, and that's okay. But at a minimum, it's worth you looking at what the data shows in terms of potential subsidy eligibility. So the tool will take the employees, and we will estimate household size and household income. We estimate household income using a fairly scientific formula, which is also something you can overwrite with your own data. So let's say hypothetically you had household income for a client. You could plug that in. But we know in a lot of cases employers don't have that, or if they do, it's maybe not 100% accurate, or employees don't want to give it to them. If it's a small enough group, you could obviously just go ask, 5, 6 people, what's your household income? But it's a bit of an invasive question, and so, employees may not want to do that. An alternative approach is we will estimate it based on census data and age. So if you're 47 living in a wealthy suburb of Pittsburgh, or you're 28 living in a not so wealthy rural area, or whatever, we're going to use those figures to estimate your household income, and that's going to then drive subsidy eligibility. But that effectively, a lot of clients don't do that today. They use W-2 wages. Okay, that's a problem. W-2 wages is wrong. That's not the way to calculate the math, and that's not accurate. And in fact, it overstates subsidy eligibility. So by doing that, you can, make it look like everybody's going to get this government assistance, and it may not be the case. I could have an employee who's an administrative assistant or a waiter or a bank teller making $40,000 a year who has a side job, or they have investment income, or they're independently wealthy for whatever reason, and their household income is a lot higher, and they're not going to get government assistance. That's an important risk to highlight to the employer. So this page, you may have had a client say to you, I think 10 of our people could get subsidies. We should drop the plan. You could fire off this page to them and say, I don't think so. Here's what my estimate is based on a more conservative analysis. You have a lot of risk if you pursue that avenue, because your employees could be very frustrated with your organization for canceling your plan if that's what they decide to do. Again, I'm talking to an indifferent client who's kind of really interested in that idea and wants to do it, and I'm looking for ways to maybe discourage that. You could also see that this analysis says I got 30 employees and 28 of them are, lined up to get a lot of subsidy assistance. That's a very valid reason to, start thinking about whether that may actually be a better approach for a client. What they could do at that point is, wage up, offer employees a salary increase in combination with letting employees go purchase their own individual coverage. We've done a lot of just a quick sidebar, we've done a lot of conversation with ERISA attorneys and experts in the industry. We don't think that it's possible to do that on a pre-tax basis using qualified health plans in the public marketplace, just for what it's worth. There are some who say you can, and we don't really buy that. The approach to purchasing individual coverage, though, can still be very viable. If you paired it with, a salary increase of $200, $300 a month, the employer could still save 20, 30% on their benefits for the year, and if the employees are eligible for subsidies, they could be getting, some decent products at a very favorable price. We will take the individual, so in addition to this page, the analytics will actually take the individual market products in the state, and it will estimate the cost of those plans based on the employee characteristics. Again, age, location, family makeup. We'll take the subsidy amount we think they could receive, net that out, and say, okay, if you were to drop your plan, this is on an annual basis what your employees would be looking at in terms of added expense. That then the employer could say, well, I'm paying for a $180,000 group plan today or a $100,000 group plan today, and the employees are paying for 20% of that. So they're paying $40,000. If we drop the plan, you're telling me it probably cost them $108,000. It just puts it in hard numbers for them to start planning around and deciding whether that's really something they want to do. Strategy number 3 is all about using a private exchange. Now, we're not a private exchange. We don't provide an electronic enrollment system for private exchange. We do have, research on kind of who the best private exchanges are, but this is something that, an agent or broker working with URL, you would bring to the table. But the presentation really covers what is a private exchange, how does it work, what are the products, and kind of what's the essence of what it can do for an employer. We offer a bit of a comparison between private and public exchanges, so that's, private exchanges versus the government's exchange. The key advantage is that you've got more diverse product set. The government exchange is medical and dental. Private exchanges offer supplemental coverage. You've got more established technology in private exchanges. That's a big point, obviously, with the snafus of healthcare.gov and the pain that was this last year's enrollment. There's a government fee on on-exchange products, unless if you're using off-exchange products, that fee is not there. On the product platform, with some private exchanges, you can actually use group insurance, not just individual. And then a lot of private exchanges will offer, third-party support. Now, a lot of private exchanges aren't free either, and there's a fee to them. But for a client that's, going to pursue this route, this is all about finding the way to kind of maintain and diversify your book. And this content puts you in the driver's seat in whether a client makes that decision or not, as opposed to reacting to that potential incentive. I'm going to skip that page. It's just sort of talking about the growing interest in private exchanges. This page is, when you run this report, you can actually customize the contribution rates. So if you were to show a client, if you were to contribute $150 or $200 or $500 a month, this is what it would cost. And it really boils down to this page, where you can show a client one of two approaches. You can say to them, if we used individual and products, this is our estimate of the annual cost to employees. The employee cost is based on the net of any subsidies they could receive, or and the employer's contribution. And so this really shows, at that high contribution level, from this page, that's $500 a month. In this particular case, the employees really wouldn't end up paying anything because they would be receiving government subsidies for the balance. You can show this without the subsidies as well, so that's important if they're not using on-exchange plans, and this covers what that actual cost would be. So this is a nice, again, this isn't based on product quotes because we don't know what employees would buy in this model. They may buy a gold plan or a silver plan or a bronze plan. It's up to them at that point. So it's based on an average cost, but it's a nice way for the employer to see, really guiding them to what that contribution level should be that they're looking to offer. That doesn't really, put the screws on the employees too tightly relative to what they may currently be paying. The last strategy is talking to clients about self-funded plans. Now, why is this in the small business section? There are a lot of employers that are interested in self-funding because it offers several advantages in the context of the Affordable Care Act. Just a couple to call out. There is a health insurance tax that is not applicable to self-funded plans. That's a 4% tax that's levied on fully insured products. That's a part of what has driven higher rates for plans this year. There is a mandate around essential health benefits that I'm sure you're all familiar with. That does not apply to self-funded plans. Self-funded plans do not have to cover 10 categories of essential health benefits. The point of self-funding is really to put the employer in a position of greater control over the cost of their insurance and the structure of their insurance plan design. It also provides them the means to gain the ROI on building a healthy workforce. So by implementing a wellness strategy, whether that's something as basic as just an annual wellness fair with free, health risk assessments and checkups, or something more aggressive like, implementing an actual care management program using a vendor, those are things that the employer now, if you do that in a fully insured plan, the insurance carrier is the one gaining the financial benefit of reduced claims cost. If I have an employee who has high blood pressure and I identify them early, and so they don't end up having a heart attack or some other very, disastrous situation that's very expensive, on a self-funded plan, I've saved myself that future claims cost, and I gain that benefit. So another way to say that is that implementing a self-funded program gives you the opportunity to gain wellness ROI. There's another reason why. Again, this all depends on the risk of the product, the cost of the product, and whether there's an effective wellness strategy in place. So I will say that of all the approaches, this one is, fairly complicated, and it's also one that really works better the larger the group is. But there are self-funded plans that are able and available for clients down to as low as 10 lives in some states. I'm actually not dialed into what's available in Pennsylvania, but I believe that there are some that operate nationally. So this presentation basically just walks the client through what are the advantages of self-funding, why now, and what it can provide them. And so it talks about, wellness plan ROI, like I was just describing, the advantages of, building a healthy workforce, not only the productivity gains, but also the actual claims cost. The aspects of a wellness program and, which services and which health challenges are specific to the group and what should be implemented. And really there's a couple more pages within the self-funded strategy, but that's kind of the essence of what that portion of the presentation talks about. So just to bring this kind of full circle, what we've done is identified the fact that employers are looking for different strategies in the market around the way they offer benefits. And we believe the best advisors are going to be the ones who present their clients with all the options as a trusted advisor, helping them identify the best solution specific to their business. If I have a healthy workforce that's younger, that is not going to have as high of a claims experience over the next several years, self-funding can be a very viable and workable strategy. Even if they aren't the hallmark of health, there's stop-loss coverage that can help that. But if I have, a client with an organization or employees that are a little bit less healthy, that's not an appropriate solution, and it may actually be worth it to maintain the group benefits policy that they have today. Does the household income that we're estimating for those employees, predict any subsidy eligibility? These are the key questions that the best advisors are talking to their clients about, and that they are working to present solutions around. So that's what we've crafted, and that's what we're working to help our members deliver. So, Christy, that's pretty much everything I wanted to work through. I think at this point we could shift it over to Q&A, or.
Okay, let me see. I was checking, and I didn't see any questions, but I will check again. No, you just did such a fantastic job. There's no questions.
How about that?
Yeah, no. Well, I think it's a fantastic system, and I know a lot of at least central Pennsylvania agents aren't using this, and I think it's going to be a really valuable tool. I mean, to go in and and meet with your clients with this kind of information. It's just, I think it's fantastic. And I thank you for today. And I did want to touch on the self-funding in Pennsylvania. We do have a carrier that will go down to 5, and I think it's getting a lot of traction. I'm seeing a lot of traction, and I'm seeing a lot of like I said, the group renewals come in,
Yeah.
and and they're like, the employers are, I can't afford this. What am I going to do? And I'll take the group and analyze it. And yeah, it's great if they're healthy. It's great if they're young. But if you have a larger group too, it could work unless you've got some really, sick people on there. But if you got, landscaping companies, young, healthy guys, and any kind of group.
Yeah,
And I will take a look at that. And we also have a great true group gap plan that our agents who are selling self-funding right now are putting that in, and essentially, they're covering the deductible almost down to, so the claims, unless they really go through the roof, that gap is covering it. And I met with one of our agents 2 weeks ago, and he had a machine shop and about 26 guys on there, and they're all relatively young, and we sat down, and they had gotten the renewal back, and I think we saved $300 per employee per month, and the employer actually completely got the concept, and he said, I have a $1,000 deductible right now, and he had one of his employees with him. He said, my employees have a $1,000 deductible. He said, if I put this gap in there, essentially, they've got a zero deductible, and I could get the claims money back at the end of the year, right? And I said, yeah. He said, basically, where do I sign? And the employee then said, I like this plan better than one we have. And he said, wait, can we put some kind of deductible on the gap? And I said, yeah. So I think it's really kind of, for the right groups, it's the wave of the future. It really is.
Hey, Christy.
Yeah.
I don't know if it was covered on this or not, but it looks like a couple questions have come in, and maybe you want to explain the capacity that we'll be providing these for Code 6.4. I think there's some questions on cost and things like that, and maybe explain how agents will use these. What it creates.
Well, and I lost my question box. Basically, I mean, the cost for you, the agent, is nothing. I mean, we have partnered with Code 6.4, so it's just a value add to you as, being, agents working through URL. So we're paying for this service to use the Code 6.4, and basically when you get a group census in, the questions on the Code 6.4 census are a little bit more, they ask some additional questions, if they know what the current premium is, if you know what the employer's household income, like Eric had said, is, because they go so in depth with, all the research and the reports that we do need additional information. The more we have, the better. So again, there's no cost for you. So if you want to, get these kind of quotes and reports from us, then just request a Code 6.4 census from either John Reel in URL's office or myself, and we can get that to you.
Yeah, so basically the agents won't be using this at all. They're going to be giving us the data. We're going to crunch the numbers and create the presentation, and then we'll spit that back out to them.
Right, and I know in the future there is an availability that, if you as the writing agent wanted, to purchase Code 6.4, Eric, if I'm correct, they could do that, but I don't know. And if you really want to crunch the numbers and put them in there, then there isn't availability for you to get this yourself. But in the interim, if you want us to do the work, then just get the census to us.
I think that answers all the questions. It looks like Sean has a question on asking who we'll be partnering with for the defined contribution implementation.
That remains to be seen. I know that's vague, Sean, but we're not quite sure yet. And do you see any other? Cause I think I had.
No, that was it. There was just kind of one on the cost, if it was a membership fee, and you kind of covered all that, and then just on the defined contribution stuff. So I think anybody else has anything, you can type it in and send it over, but I think that's it.
Yeah, no, actually, and I'm just checking my question box did pop up, but I think that's all. And again, you guys contact me. If I don't have the answer, then I will go to Eric and get that. But start sending your censuses in, and we'll get rolling with this. Thank you, Eric.
Yeah, you bet. Thank you, everybody.
Right.
It was good talking.
Right. Bye-bye.
See you.